Hi, good afternoon. My name is Dr. Arnold. I'm one of the psychologists at PCH, and I'm a member of the complex headache team with Dr. Rastogi, who sees our families um, on a bi-weekly basis to talk through and identify how exactly mood, anxiety, depression, anger is impacting their headaches, their functioning, and how we can support them from a holistic or whole child perspective. So the focus of my presentation today is really going to be kind of looking at, and like Dr. Little said, really looking through the lens of the relationship between migraines, anxiety, and depression. One second. Okay, here we go. So as Dr. Little spoke about, the complexity of migraines is quite varied. And what we have learned about it as it being a genetic condition, anxiety and depression also have load very heavily on anxiety and load very heavily on genetics. And so you'll often see anxiety and depression also running through families who have or do not have migraines. What we've learned through research is that the relationship between mood functioning and migraines and mood is that it's a bidirectional or two-way relationship. Individuals with anxiety or depression have an increase in migraines, and those with migraines will show us an increase of depression and anxiety symptoms. So let's look at this. What is anxiety? What is depression? We're going to start talking a little bit about depression, and I wanted to operationalize it. So we had a kind of shared language for what I would be talking about when I looked at depression. So when I look at depression, I sort of think about it in four broad categories: emotions, thoughts, behavior, and the physical experience of depression. Each of these has a unique constellation for each person. And so the idea of symptoms of depression and a diagnosis of depression isn't exactly a direct relationship. Many of us have natural experiences of moments of feeling sad or feeling withdrawn. Those are part of the daily life. Those are part of our natural human functioning. It's when we get to a place where that our functioning is impaired by the cluster of symptoms that we are experiencing that I would look more diagnostically at depression, but still recognizing that symptoms of depression, particularly in relationship to migraines, can be challenging to manage. And symptoms of depression can also increase the likelihood of migraines. So if we were to look at this list, and if you take a minute to look through it, if I changed the name and I had symptoms of migraines up there, how many of these would you also endorse within your migraine world? Do you have moments of feeling sad about your migraines, anger that you're missing out on events that you enjoy, feeling withdrawn from others, or having to neglect responsibilities that are important to you? Do you have impairment in your memory or concentration? So the overlap for what our symptoms look like between depression and migraines is important to note because that does also feed into how we are going to look at treating these things. So one of Stephen Baskin, not Carol Baskin, the tiger lady, mentioned that having symptoms of depression and anxiety create diagnostic complexity. Who you're talking to will very much shape the lens of how we're evaluating headaches, migraines. Are we looking at it through the psychological lens of depression and anxiety? Are we looking at it through the neurological lens of how our mood is being impacted by our headaches or migraines? So being able to speak with people who have both a perspective on your symptoms from a psychological perspective and a neurological perspective are important because both of them both disciplines can contribute to our choices for treatment and how we can work collaboratively to help a person manage both the anxiety and depression that they feel as well as the migraines that they're experiencing. Interestingly, when we look at chronic pain, and migraines often fall within that chronic pain purview, and depression, is that not only do they co-occur, but they actually promote the development of each other. So migraines beget depression, depression begets migraines, anxiety is the same way. And so we almost have scaffolding or building block happening within our brains, within our functioning to promote the development of both disorders. Like I said, it's important to treat both, and we can look more towards that towards the end of my presentation to talk about what that looks like in terms of co-treating. It's important to note that non-adherence to migraine treatment is recommended if it is recommended happens 3 times more likely if a person is experiencing depression and anxiety. Working in our headache clinic, we often see families who are really struggling to adhere to the treatment recommendations for their migraines. Things like sleep and diet, nutritional changes, all of those are parts of that migraine treatment that if you're feeling anxious or depressed can be that much more difficult to participate in. So I wanted to take a moment and to talk a little bit about diaphragmatic breathing. This is something that we talk about all the time. Taking a deep breath, do some belly breathing. All of that has been found to be helpful, not only in pain management, but also in management of depression and anxiety symptoms. The problem is that we don't all know how to take a really good deep breath. So I wanted to pause for a minute and I wanted to do a very short video that really does a nice job of explaining exactly what it means to take a deep breath so that when you're in your own practices, when you're in your own home or in bed at night, that you have an opportunity to know what it feels like to take a true deep breath so that you can feel the benefits of it.
Diaphragmatic breathing, aka belly breathing, is our most efficient breath. It's also a calming breath. It taps into the nervous system and tells it to calm down. When we were first born, if there weren't any complications, we were all born as belly breathers. As we get older, we tend to become more thoracic chest breathers, much like this. So I'm going to teach you how to breathe with your belly. Start by laying down on your back. Place one hand on your chest and one hand on your belly. Take a slow, deep breath in through your nose. Feel your belly rise. Breathe out. Feel your belly flatten. Try to keep the hand on your chest as still as possible. Repeat for 10 breaths. You may place a small object on your belly instead of your hand, and you'll notice it moving up and down. Let's move to a standing position. Put one hand on your chest, one hand on your belly. Breathe in slowly through your nose. Feel your belly rise. Breathe out. Feel your belly flatten. Try to keep your hand on your chest as still as possible. Repeat for 10 breaths. Finally, let's come to a comfortable seated position. Place one hand on your chest and one hand on your belly. Breathe in slowly through your nose. Feel your belly rise. Breathe out. Feel your belly flatten. Try to keep the hand on your chest as still as possible. Repeat for 10 breaths. Practice belly breathing in all 3 positions: lying down, sitting, and standing, twice daily. Complete 10 good belly breaths in each position. These are the steps to learn belly breathing. Eventually working.
I paused it right there just because it goes into utilizing belly breathing as it relates to exercise, which I think is great because what it's trying to say is that belly breathing isn't something we should be doing as an exception to our day, but it's actually how we would be best helped by breathing all the time, even when we're exercising, which we tend to take shorter, more shallow breaths as our exercise exertion increases versus taking longer, slower breaths down into our diaphragm to allow us to be able to more likely to manage our exercise endurance. So when you think about deep breathing, think about it as a change to your standard breathing practices to really help you be more in control from a pain management perspective, but also a mood management perspective. So let's talk about anxiety. So anxiety, like migraines and depression, all sort of cluster together. It is so common to see anxiety symptoms with migraines and migraines in people who have higher levels of anxiety. The relationship between these are well documented. But not only that, anxiety is just a common thing that happens during teenage years. 1 in 4 kids will develop some sort of anxiety-based disorders between the ages of 13 and 18. And part of that could also include experiencing an increase in migraines and headaches. But conversely, if you have migraines and headaches, you may also have an increase in your feelings of anxiety. But why is that? So with migraines and anxiety, what we often see is a conditioned response, if you will. Our mind does not like feeling pain. It's uncomfortable. And therefore, we start worrying, when am I going to experience pain again? What is that going to be like? So we have an anticipatory fear reaction to pain. So what we start doing is we start thinking about, when am I going to have this happen again? Under what conditions? What happened last time that I can think about so that I don't put myself in that position again? And so that pairing between our fear response and our pain increases our worry. And the thing about worry and anxiety creates worry and anxiety. It definitely tends to pile on itself. So what we do notice is that people who have headaches or migraines all of a sudden have like a proliferation, and now they're worrying about other things more consistently, and they start pairing and chaining these things together. Conversely, if you have anxiety disorder and you experience a headache, you start worrying more about having headaches again, like I had mentioned before. And then you have, again, that cognitive escalation of fear and worries. Interesting, there's also a relationship between what happens when we have an anxiety increased experience and when we have a headache. We tend to have auras, we clench our jaws, we have muscle tightening throughout our body. That makes our headaches so much worse. But in our body, if we're having that type of response, it also creates a headache. And so, again, it's going both directions between anxiety and headache, or migraine and migraine to anxiety. We also see within anxiety avoidance behaviors. We don't want to deal with things that create stress for us, stress, worry, fear. So we start avoiding those circumstances and situation. What we find is that with headaches or migraines, we do the same thing. We start looking for those examples of when we had a migraine and we stop doing those behaviors as well. And it creates like a feedback loop to anxiety. So I'm avoiding doing things, I must be worried about them. Therefore, I'm not going to do them anymore. The co-occurrings often fall within generalized anxiety disorder, panic, phobias, and PTSD are more frequently noted with migraines than other anxiety-based disorders. Oh, sorry, I wanted to go over something. So one of the things I talk about a lot with my teens is how do we, within our thoughts, sort of manage these anxiety moments, this anxious feeling that we can get, particularly around our migraines. So you'll think, if you think about how you think, I love this cartoon by Family Circus. It says, yesterday is the past, tomorrow is the future, but today is a gift. That's why it's called the present. I'm sure we've all heard different versions of this, but what I really love about it is because it helps us remember that being in the present, in this moment, is an excellent way to manage anxiety. Anxiety comes from a variety of things, but with our thoughts, it comes from the woulda, shoulda, couldas of things that have happened in the past. I wish I had done that differently. I wish I didn't do that. I should have done something different. Or thinking about the future. What's going to happen tomorrow? If I do this, will that happen? I should do this. I could do this. And so we just build up these thoughts, but we have to remember that we're no longer in the past and we're not yet in the future. Another version of this quote that I actually think is a little bit better is tomorrow is a mystery, meaning we can do all we want to guess and to think about what tomorrow is going to look like, but we just don't know. And so by bringing our mindfulness and our thoughts back to this exact moment in time, how do you feel right now? How do you feel in your body right now? And what can you do right now to help you feel better? One of the activities that you can do is called a grounding exercise. It pulls your mind out of the past. It also pulls it back from the future and brings you into this moment because this is the moment that we can change. So let's do a really simple grounding exercise. I'd like you to take a moment, feel settled in your chair, and I'd like you to think about 5 things that you can see. Run them through in your head. Look around, take in your environment. Try to notice details that maybe you had skipped before or skipped over. Now I want you to think about 4 things you can feel. Now, this isn't necessarily based on your emotions, it's kind of based on your physical experience. I can feel the shirt It's kind of silky, and I'm feeling that on my arms. Or I'm feeling how straight my legs are and the tension in my muscles. I can also feel whether or not the air conditioning is clicking on and off, creating a breeze. What are the four things that you feel? Now listen. What are the three things you hear? You hear my voice, maybe you hear background noise, things from outside. Really focus in on what you hear right now. Bring your awareness to now. What are two things that you smell? Is someone cooking something in the other room? Perhaps the lingering smells of breakfast, favorite perfume. And then what's the one thing you taste? What's the flavor on your tongue, maybe from your last meal or having brushed your teeth? I often like to notice that I still can taste my morning coffee. Maybe not right now, but that's always a nice one for me. So being able to pull your mind from where it is into where it needs to be right now is a really nice way to take a step back from the things that tend to create feelings of anxiety and worry. And by being able to ground ourselves, we give ourselves an opportunity to take that much needed deep breath, to figure out what we need to do right now in order to help us with our migraine management, our mood management, our anxiety management. So, in closing, anxiety and depression are commonly co occurring disorders with migraine. But remember, it's a bidirectional relationship. Therefore, you can have anxiety and depression and it can lead us to an increase in headaches or migraines. So, what we want to do is ultimately treat both. Be great for you to be able to find a psychologist or therapist, a counselor, someone you can talk to who is invested in understanding the biobehavioral aspects of therapy to help you not only manage the anxiety and the depression, the pain and stress that you may be under, but also being able to work closely with your neurologist or your neurology team to be able to better offer that comprehensive care that's so valuable. So, things you want to look for in your community are therapists who are invested in cognitive behavioral therapy, which is addressing our thoughts, our feelings, and our behaviors in order to be able to make the changes that we need to help alleviate depression and alleviate anxiety. Biofeedback is another one that's shown a lot of great outcomes with handling both depression, anxiety, and migraines, which is learning to control features of our functioning that tend to be considered autonomic, which means happening without our thoughts. So things like being able to help control and regulate your heart rate, or being mindful of your muscle tension and bringing your awareness into relaxing those muscles, or even being able to manage and reduce your blood pressure from moment to moment will also be very helpful in managing your migraines as well as your anxiety and depressive symptoms. Relaxation and mindfulness, stress management, all of those things by being able to be more mindful, by being able to focus on our breathing, being able to ground ourselves in right now versus the past and the present can be very helpful in reducing our anxiety and our depression symptoms. At PCH, we offer a complex headache clinic, myself and Dr. Rastogi, who meet with families who either have had resistant headaches, migraines, and they just need to maybe consider a more holistic perspective on what could be contributing to those headaches and migraines, and being able to offer that comprehensive care in both the psychological world as well as the neurological world. Dr. Rastogi is going to be talking to us later on about lifestyle modifications, things that we can do in our everyday life that are not just helpful for our migraines, but also are helpful for anxiety and depressive symptoms. Seek out these opportunities to enhance the quality of your life. It can be very difficult to have ongoing pain and pain management that feels almost like it's a runaway train and you have lost control of that. Look for opportunities to take back some of that control by doing what you can when you can so that you can feel better and feel that higher quality of life that we all want. There are lots of great resources out there. Dr. Rastogi also has some included in her presentation that would be helpful to note. I actually have found that these three apps are great. Mindshift is awesome. It's a free app and it's really focused around anxiety and anxiety experiences, and it includes quick relief as well as awareness of your symptoms and being able to sort of assess where is your anxiety at any given time. Mindspace does have in-app purchases, but they have lots of really great audio recordings, mindfulness, guided imageries. Calm is another one who offers the same things. Thank you to Kelly and Miles for Migraines for being able to host presentations such as these to really help people. There are support groups that can be helpful to get into, activity groups, and another psychologist who's well known in migraine world who has a wonderful website is Dawn Busey. So thank you so much for letting me present to you today, and please let me know if you have any questions.